I begin today by acknowledging the Dharawal people, traditional owners and custodians of the land on which I am on, and I pay my respects to the elders past, present and emerging. I extend the respect to Aboriginal and Torres Strait Islander peoples listening today. Today I will be exploring low physical activity in older Australian adults, those that are 65 years and older, sometimes referred to as the ageing population. According to the Australian Institute of Health and Welfare 2021, older Australians are generally those aged 65 and over. Older Australians are a diverse group with different ages, socioeconomic backgrounds, life experiences, and lifestyles. Low physical activity among older people can create many health, economic, and community issues. An individual's health declines when they undertake a low level of physical activity. The Physical Activity and Exercise Guidelines recommended by the Australian Government's Department of Health recommends that people over the age of 65 years complete at least 30 minutes of physical activity per day. A low level of physical activity is below this recommendation. Low levels of physical activity can cause high morbidity, decrease in life expectancy, increased risk of falls, decreased quality of life, increased risk of health problems. According to the Australian Institute of Health and Welfare 2020, in 2015, the burden due to this insufficient physical activity for associated diseases was 19% for type 2 diabetes, 17% for bowel cancer, 16% for uterine cancer, 14% for dementia, 12% for coronary heart disease, 11% for breast cancer, 10% for stroke. The Australian Bureau of Statistics 2020, the National Health Survey, found that in 2020 to 2021, around 4 in 10 people aged 65 years or over met the physical activity guidelines. Half undertook at least 30 minutes of physical activity on 5 or more days, and a similar rate engaged in daily physical activity. The underlying social determinants of health and environment. Neighbourhood design is an underlying factor due to unsafe walking spaces, including higher traffic areas, high vehicle speeds, and unsafe or lack of footpaths. Many footpaths are not designed with assistive devices in mind or enough signs for those with memory issues. Lack of accessible transport in either a bus stop that is too far away or too hard to get to. The transport may not be able to accommodate an assistive walking device or wheelchair, or there may be no option of public transport in places such as a rural area. The economic high cost of services such as memberships to gyms or sporting programs are difficult for many older people as they have low incomes and do not have disposable income to invest in physical activities. Community attitudes towards older adults are they too frail to do physical activities and exercises or sports. Some older people are socially isolated, which can be unmotivating as there's no one to do an activity with unless it's linked in with a social service. Older people have chronic health illnesses, which means they may need help from an allied health, which they may not have access to due to transport or location, such as a rural area. Some barriers to physical activity. Some older people would prefer to do inactive hobbies, such as reading, watching television, or having lunch with friends. There's a high cost for sports, gyms, and they're not usually accessible for older people due to their high costs, and marketing is usually to a younger audience, so they may feel out of place or unwelcome. Exercise programs are advertised online, and older people may not be able to find these easily without assistance. A legitimate risk of falling due to low muscle tone and balance issues, which can lead to significant injuries or disability. A hazardous environment, unmaintained pathways, high traffic areas, low lighting, hills, and a lack of park benches for resting on. little to no access of public transport to green areas with appropriate amenities, lack of social support which can relate to unmotivation and ill mental health, chronic illnesses of the heart, lung, arthritis, osteoporosis, and diabetes which can make it unsafe to exercise without an assistance or with the assistance of an allied health professional. Stepping On is one of the programs for older people that New South Wales run with the Active and Healthy project. The Stepping On program's purpose is for fall prevention. As seen in Figure 1, the program has shown to decrease the need for health services due to a fall for up to 6 years after engaging with the program. However, after 6 years, this declines, suggesting that the older people may need a revision in the program to benefit them and to reduce falling rates in the longer term. However, there needs to be more research conducted into this to see the effectiveness of a refresher program. Through attending, the older adults can gain knowledge and learn how to do gentle exercise to decrease risk and falls and increase mobility. It's also in a community supported and social environment which to increase motivation and attendance. The program increases physical activity among participants and decreases fear of falling, as well as instances of falling and injury, which leads to less pressures on the healthcare system. The program is for anyone over the age of 65 and has no cost, which is helpful for older people who have a lower income. Some places offer community transport for their participants to enable access. The program not only assists with the prevention of falls, but it is also a group program. It fosters social support while providing knowledge and instilling confidence and empowers participants.